Dementia doesn't arrive overnight, it creeps in silently, often mistaken for simple forgetfulness. But make no mistake, every 3 seconds, someone in the world develops dementia, according to Alzheimer's Disease International. In the US alone, over 6.9 million Americans are living with Alzheimer's, the most common form of dementia, and the number continues to grow. Despite how widespread this condition is, the early signs are still too often brushed off as just getting older. That's a dangerous myth. Dementia isn't just about forgetting birthdays or misplacing your keys. It's a progressive neurological condition that begins with small but significant changes, ones that, if caught early, can give patients and families a crucial head start on treatment and support. Today, we're diving into the 10 early warning signs of dementia, how to recognize them, how they differ from normal aging, and why timing is everything. Studies show that early intervention can slow cognitive decline, reduce behavioral complications, and improve quality of life for both patients and caregivers. So as we go through each sign, think not only of yourself, but of your parents, grandparents, neighbors, or friends. Because awareness isn't just power, it can be a lifeline. And if even one symptom resonates, don't delay. Talk to a healthcare provider. Because the earlier dementia is recognized, the more options you have to fight it. This video is intended for educational purposes only and is not a substitute for medical advice. Please consult your physician for diagnosis or treatment. 10. Trouble with visual and spatial relationships. Visual and spatial relationship difficulties represent a complex early sign of dementia that affects how people perceive and interact with their physical environment. These problems go beyond normal vision changes associated with aging, and involve alterations in how the brain processes visual information and understands spatial relationships. Early signs of visual spatial problems include poor depth perception, making tasks like using stairs, escalators, or curbs difficult. These issues stem from the brain's processing of visual information, not eye problems. Reading becomes harder due to trouble tracking lines, skipping words, or losing place. Even familiar documents may seem confusing. Driving may become unsafe, as judging distances, parking, and navigating traffic grow difficult. Distinguishing colors and contrasts also declines, affecting daily tasks like dressing, finding items, or noticing cues in the environment. Balance and coordination often suffer, increasing the risk of falls and making it harder to move around or perform tasks needing precision. Some may become confused by mirrors or reflections, not recognizing themselves or reacting fearfully. Symptoms typically worsen over time, from struggling with maps or directions to difficulty with basic tasks like reaching or walking. Navigation in known places can become confusing, especially in complex or multi-level spaces. These issues raise safety risks like falls or accidents due to poor spatial judgment. Emotionally, people may feel anxious or frustrated by lost abilities, affecting independence. Professional evaluation helps distinguish between eye problems and brain-related processing issues. Adapting environments like improving lighting, using contrasting colors, and creating clear paths can support safer, easier navigation. 9. Changes in sleep patterns. Sleep pattern changes represent a frequently overlooked but significant early sign of dementia that can have far-reaching effects on cognitive function, mood, and overall health. These changes go beyond typical age-related sleep variations and often involve dramatic alterations in sleep-wake cycles that disrupt both the individual and their household. Insomnia is one of the most common sleep disturbances in early dementia, characterized by difficulty falling asleep, staying asleep, or both. Someone might lie awake for hours each night, unable to quiet their mind or get comfortable. This isn't the occasional sleepless night everyone experiences. It's a persistent pattern that leaves people exhausted and affects their daytime functioning. Sleep disturbances are common in dementia and often include frequent night wakings, confusion, and difficulty returning to sleep. Some individuals experience day-night reversal, staying awake at night and sleeping during the day, which disrupts routines for both them and caregivers. As dementia progresses, restless sleep, vivid dreams, and increased movement during the night may occur, leading to unrefreshing sleep. These issues stem from brain changes, anxiety, depression, and medication side effects. Environmental factors like unfamiliar surroundings or changes in routine can also impact sleep. Poor sleep worsens dementia symptoms, increases fall risk, and affects mood and immune function. Daytime fatigue, reduced concentration, and accidents are common. Treatment includes good sleep hygiene, comfortable sleep environments, and in some cases, medication. Caregivers also need support and professional guidance to manage these challenges and ensure safety and rest for all. 8. Withdrawal from social activities. One of the lesser-known yet deeply telling early signs of dementia is a slow and steady withdrawal from social life. This change doesn't happen overnight, it unfolds quietly, almost invisibly at first. A person who once looked forward to book clubs, family dinners, or weekend outings may begin to pull back, offering vague excuses or expressing disinterest. But this isn't just a passing mood or fatigue. It's a behavioral shift rooted in fear, confusion, and a growing awareness of one's cognitive struggles. As memory lapses or trouble following conversations become more frequent, individuals may retreat to avoid embarrassment. Even simple social exchanges, remembering a name, staying on topic, or keeping up with group chatter, can feel overwhelming. This self-imposed isolation often worsens with time, leading to emotional numbness, deeper anxiety, and even depression. Beyond emotional impact, isolation has biological consequences. Numerous studies show that reduced social engagement accelerates cognitive decline and increases the risk of dementia progression. The brain, like any muscle, weakens when underused, especially in the absence of conversation, laughter, and connection. Instead of pushing, they can gently rebuild bridges, offering company in low-pressure settings, encouraging shared hobbies, or introducing structured group programs tailored to early-stage cognitive challenges. Social bonds are not just comforting, they are protective. Supporting someone to stay connected could mean preserving years of clarity, independence, and self-worth. 7. Mood and behavior changes. Mood and behavior changes often represent some of the most challenging aspects of early dementia for both individuals and their families. These changes can be subtle initially but tend to become more pronounced over time, affecting relationships, social interactions, and overall quality of life. Understanding these changes as symptoms rather than personality flaws is crucial for maintaining compassionate relationships. Depression and anxiety frequently emerge as early signs of dementia, sometimes appearing months or years before memory problems become obvious. People may experience persistent sadness, worry, or hopelessness that seems unrelated to their circumstances. These mood changes aren't simply reactions to aging or life changes. They often reflect chemical and structural brain changes associated with developing dementia. Behavioral changes like irritability, agitation, and apathy are common and constrain relationships. A once patient person may now overreact to minor issues, withdraw from hobbies, or lose interest in social activities, not due to laziness but changes in the brain. Paranoia may develop, leading to unfounded suspicions of others. Sleep disturbances like insomnia or reversed sleep cycles are also common and can worsen symptoms. Social withdrawal often occurs as people notice their cognitive decline, which can lead to isolation and further mood issues. Personality shifts can be especially upsetting for loved ones. Someone outgoing may become quiet, or a reserved person may act inappropriately. These changes vary by individual and can be influenced by health and environment. It's vital to distinguish dementia-related symptoms from other causes like medications or illness. Treatment may include medications, structured environments, and behavioral strategies. Family support and education are key to managing changes and preserving relationships. 6. Misplacing things. Misplacing items and being unable to retrace steps represents a particularly frustrating early sign of dementia that affects daily life in numerous ways. While everyone occasionally misplaces keys or glasses, dementia-related item misplacement follows different patterns and creates more significant problems than typical forgetfulness. The key difference lies in both the frequency and the unusual locations where items are found. Someone with early dementia might put milk in the pantry instead of the refrigerator, place car keys in the freezer, or store important documents in completely illogical locations. These aren't simple mistakes. They reflect changes in cognitive processing that affect logical thinking and memory formation. Losing items is especially hard for people with dementia because they often can't retrace their steps. This makes finding lost items difficult and can lead to painful accusations of theft, causing stress in relationships. Early on, items may be misplaced in logical but wrong places. But as dementia progresses, things may end up in strange spots like clothes in the kitchen or food in drawers. Losing essential items like medication or IDs can have serious consequences, and safety becomes a concern when dangerous objects go missing. The emotional toll is significant. People feel frustrated, anxious, and embarrassed, which can worsen other symptoms. Some develop coping strategies like keeping duplicates or using one storage spot, but these often fail as the condition worsens. Families can help by organizing the home, reducing clutter, and labeling items. Technology like key finders and smart home devices may help if the person can still use them. Occupational therapists can also suggest practical home changes and strategies. It's important to respond to confusion and accusations with empathy, not frustration. 5. Poor judgment. Changes in judgment and decision-making abilities often represent some of the most challenging early signs of dementia for families to recognize and address. These changes go beyond occasional poor choices that everyone makes. They represent a fundamental shift in how someone processes information, weighs options, and makes decisions that affect their safety and well-being. Financial judgment frequently shows the earliest signs of decline. Someone might make unusually large purchases they can't afford, fall victim to scams they would have easily recognized before, or give money to questionable charities or causes. They may become either extremely generous to the point of financial harm or unusually suspicious of legitimate financial institutions and advice. As judgment declines, personal safety often becomes compromised. People may leave doors unlocked, become overly suspicious, continue driving despite risks, or stop driving out of fear. Hygiene and self-care can suffer with neglect of grooming, inappropriate clothing, or ignoring health symptoms. These changes stem from cognitive decline, not laziness or depression. Social judgment may also deteriorate, leading to oversharing, inappropriate comments, or difficulty understanding boundaries. Medical decisions become unreliable. People might refuse care, forget medications, or misjudge symptoms. Families often face challenges in addressing these issues without seeming controlling. Empathy and early professional evaluation can help distinguish dementia from other causes. Legal and financial planning, including powers of attorney and healthcare directives, should be addressed early to preserve autonomy and ensure protection. 4. Disorientation to time and place. Disorientation to time and place represents one of the most concerning early signs of dementia, often appearing subtly before becoming more pronounced. This goes beyond occasionally forgetting what day it is or losing track of time while engaged in an activity. Dementia-related disorientation involves consistent confusion about temporal relationships and spatial awareness that significantly impacts daily functioning. Time disorientation often manifests first as confusion about dates, seasons, or the passage of time. Someone might think it's morning when it's actually evening or believe it's winter during summer months. They may lose track of how much time has passed during activities, spending hours on tasks that typically take minutes, or become impatient when activities take their normal duration. Understanding sequences of events becomes problematic. A person might become confused about whether something happened yesterday, last week, or last month. They may have difficulty understanding concepts like later today or next week, making it challenging to plan activities or keep appointments. Getting lost in familiar places is a deeply unsettling sign of spatial disorientation. At first, confusion may occur in new places like stores or restaurants. But over time, it can happen even at home. People may forget room locations, struggle with directions or maps, and become confused by GPS. Temporal disorientation can also cause people to dress inappropriately for the season, not from stubbornness, but true confusion. These issues pose serious safety risks. Individuals may get lost, leave stoves on, or miss appointments. Loved ones often notice when someone starts getting lost or confused about dates and seasons. Technology like reminders can help early on, but as symptoms worsen, supervision may be needed. Disorientation can cause fear, anxiety, and depression. Professional evaluation is important to assess the condition, recommend safety steps, and provide support. Early intervention helps families plan and maintain independence as long as possible. 3. Language problems. Language is often one of the first areas quietly affected when dementia begins to set in. A once fluent speaker might now pause unexpectedly in mid-sentence, reaching for a familiar word that stubbornly refuses to surface. These moments aren't just about forgetting names or occasionally mixing up words, they signal a deeper disruption in the brain's language centers. Instead of clearly naming objects or expressing thoughts, a person may begin to describe things indirectly, relying on gestures or vague descriptions. For example, they may point and say "that thing over there" instead of naming what they mean. This can make conversations feel disjointed or confusing, especially for loved ones who are used to more fluid exchanges. Understanding what others are saying also becomes a challenge. Following a conversation with multiple speakers or topics can feel overwhelming. People may lose their place, ask repetitive questions, or seem disconnected even when they're trying to engage. The frustration this brings often leads to shorter, simpler conversations, or avoidance of dialogue altogether. Writing and reading don't escape unscathed either. People might struggle to complete a coherent note, forget how to spell routine words, or lose the thread of a newspaper article. Repetition becomes more common, not just in questions but also in stories or phrases, as the brain defaults to familiar speech patterns. These language changes can deeply impact confidence in social interaction. That's why support from family and professional therapists is vital. Small adjustments, like speaking slowly, using clear language, and allowing more time for responses, can make a world of difference. If you notice consistent struggles with communication, it's worth seeking medical insight early. In many cases, early attention can delay progression and ease frustration, for both the individual and those who care for them. 2. Difficulty with familiar tasks. One of the most telling early signs of dementia is when someone begins struggling with tasks they've performed countless times before. These aren't new, complicated activities. They're routine tasks that have been part of daily life for years or even decades. This difficulty represents a breakdown in procedural memory and executive function that goes far beyond normal aging. Consider activities like balancing a checkbook, following a favorite recipe, or operating household appliances. These tasks require multiple cognitive skills working together: memory, attention, problem solving, and sequencing. When dementia begins affecting the brain, these complex cognitive processes start to break down, making familiar tasks suddenly feel foreign and overwhelming. Someone might begin taking longer to complete routine tasks or need to concentrate harder on activities that were once automatic. They might skip steps in familiar processes or become confused partway through completing a task they've done thousands of times before. Early signs of cognitive decline often appear as struggles with everyday tasks. Someone who once used a smartphone or computer easily may forget basic functions or become confused by familiar apps. Similar issues can arise with driving, getting lost in known areas or forgetting traffic rules, and managing finances, like paying the same bill twice or misreading bank statements. Household tasks may also become difficult. Cooking familiar meals or doing minor repairs can feel overwhelming, not due to physical issues, but cognitive changes. These challenges often lead to frustration, anxiety, or withdrawal, with noticeable mood changes. It's important to distinguish occasional mistakes from ongoing problems. When difficulties become frequent and affect independence, medical evaluation is essential. Early diagnosis can identify conditions like dementia or other treatable issues such as vision, hearing, or medication side effects, ensuring the right support is provided. 1. Memory problems. Memory problems are often the first sign people notice when dementia begins developing. However, not all memory issues are created equal, and understanding the difference between normal forgetfulness and concerning memory loss is crucial. The key distinction lies in how these memory problems interfere with daily functioning and independence. Normal age-related memory changes might include occasionally forgetting where you placed your keys or struggling to remember someone's name during a conversation. These moments are frustrating but don't significantly impact your ability to live independently. In contrast, dementia-related memory problems are more persistent, severe, and interfere with routine activities. People experiencing early dementia often forget recently learned information or important dates and events. They might repeatedly ask the same questions within minutes of receiving an answer. This isn't simply absent-mindedness. It's a consistent pattern of being unable to retain new information despite repeated exposure. Short-term memory loss is often the first sign of decline. A person might forget recent conversations or meals, struggle with instructions, or miss appointments even after noting them down. Meanwhile, long-term memories usually stay intact, leading to confusion both for the individual and loved ones because they seem to remember the distant past just fine. Emotionally, this can be distressing. Many people realize something's wrong before others do and may avoid social situations out of embarrassment. Some try to hide the issue by relying on notes or asking others to repeat things. Family members often notice memory changes during everyday interactions. A parent might repeat questions, forget recent events, or struggle with familiar tasks like cooking or remembering birthdays. Memory decline varies. Some experience a slow change, others more rapid. Occasional forgetfulness is normal, but ongoing memory issues that affect daily life should be checked by a doctor. Healthcare providers look at how memory impacts work, relationships, and independence. They may use tests, review medical history, and sometimes do brain scans. If memory problems persist, seek help early. It may not be dementia, but early evaluation can help manage symptoms and plan ahead. Recognizing the early signs of dementia isn't just about awareness, it's about taking control of your health and the health of your loved ones. The earlier we identify the symptoms, the more options we have to slow progression, provide care, and preserve independence. If even one of these signs feels familiar, don't ignore it. Talk to a medical professional, seek support, and stay informed. If you found this information valuable, make sure to subscribe to our channel and turn on the notification bell so you never miss a video on brain health, aging, and practical wellness strategies. Together, we can build a more informed, compassionate community, one video at a time.